Hi, Dr. Nakayama.
Hi, Dr.
Welcome. So Dr. Nakayama is the director of the Animal Medical Center and professor of College of Bioresource Sciences at Nihon University. He has a bachelor's degree from the School of Veterinary Medicine, Azuba University, Ph.D. From the Graduate School of Veterinary Medicine at Azuba University, and he was a research scientist at Veterinary Biosciences at The Ohio State University College of Veterinary Medicine. We just missed each other because I got there in 2005 and you had just left. He was then an associate professor of veterinary medicine at Miyazaki University, and now, again, the director of the Animal Medical Center and professor at Nihon University. So welcome, and we look forward to hearing your presentation.
Well, thank you very much for introducing me, Dr. London. I used to work at the Ohio State University at the Dr. Hamlin's lab, cardiovascular lab, so I'm in the totally different field. So about 4 years have passed since we started SQAP radiotherapy at Nihon University Animal Hospital. Now the total number of cases has reached over 400. Well then, I'd like to take this opportunity to talk about why SQAP has come to be used for radiotherapy in so many cases. These are what I'm going to talk about. First of all, I'm going to talk about details of the cases used for SQAP radiotherapy. Next, I'm going to explain how to administer the SQAP and the radiation protocol we used. At last, I show you some tumor cases for which we used SQAP. Next, please. The graph shows a breakdown of cases treated with SQAP radiotherapy. Total number of cases, 289 from July 2017 to January 2020, of which 3/4 of cases are dogs and the rest are cats. By the way, we have never used SQAP for other than dogs and cats. Next, please. The graph shows the treatment sites in dogs. Because of the nature of the radiotherapy, most of the tumors were head tumor. Cases for nasal cavity, or the oral cavity, and brain were almost evenly divided. Next. Next, I'm going to explain the treatment sites in cats. More than half cases were intranasal tumors, and 1/4 of cases were oral tumors. Next, please. And these graphs show a breakdown of nasal tumors. In the dog, 57% of cases were adenocarcinome, and 9% of cases were squamous cell carcinoma. 17 cases could not be identified the type of tumor, but most of them were presumed to be epithelial. In the cats, more than half of the cases were lymphoma, and 36% of cases were adenocarcinoma. Next, please. This graph shows a breakdown of oral tumors. In the dog, malignant melanoma was 57%, and the squamous cell carcinoma was 22%. In the cats, more than half was squamous cell carcinomas. Next, please. The slide shows how we performed SQAP radiotherapy. 15 to 30 minutes before irradiation, we infuse SQAP 4 milligrams per kilo intravenously over 2 to 5 minutes. Then we anesthetize animals using propofol and isoflurane. For radiotherapy, we use 4 megabaud X-ray The radiation protocol was palliative, and the total X-ray dose was 28 from 28 to 36 gray in 4 to 6 fractions. Next, please. Now I will tell you how we came to use SQAP on a daily basis. 4 years ago, Professor Sahara introduced me SQAP. I heard the development of SQAP started with something extracted from sea urchins, and I felt it's very strange. As you hear now, sea urchins are pronounced uni in Japanese. We eat the yellow stuff of them. It may be gross for you, but it's high-class ingredient for sushi in Japan. Patients who are not indicated for surgery are often referred to radiotherapy. Then, without exception, the owner always longs for loving animals to receive radiotherapies as the last remaining remedy to improve their QOL, even if they don't live long. In such a difficult situation, I was looking for a way to enhance the effectiveness of radiotherapy. Dr. Sahara said that SQAP didn't have major side effects, so we decided to start using SQAP in patients where radiotherapy did not work well or were not expected to be very effective. Now I'd like to introduce you a beginning case where we came to use SQAP on a daily basis. Next, please. The patient is an 8-year-old Siamese cat with nasal lymphoma. The forehead is swollen due to the nasal tumor. Next, please. This slide is CT image before radiotherapy. You can see the occupying region in the left and right nasal cavity, destruction of maxilla, and the infiltration of the tumor into the left orbit. This case was initially treated with radiotherapy without using SQAP. Next, please. After starting radiotherapy, the swelling of the forehead improved slightly, but then quickly re-enlarged despite the duration of the treatment. At the end of radiotherapy, the slide shows, the swelling became easier to see as shown on the slide. Lymphoma in general is highly radiosensitive, but we judged that the lymphoma in this case was radiation resistant. We suggest to the owner that there was a possible option that allows for additional irradiation in combination with SQAP. Next. The slide shows the phase 1 week after the first irradiation with SQAP. Unfortunately, the regular radiotherapy didn't show enough effect, but this time I was very surprised that the tumor shrank and the face returning to normal and lovely as before. The response in this case convinced us that SQAP had a sensitizing effect on spontaneous tumors. Next, please. It is difficult to control feline oral squamous carcinoma with palliative radiotherapy. This tumor should be treated surgically, but it usually grows so fast that patients have already missed the surgical opportunity at the time of the diagnosis. Such cases end up in radiotherapy. We attempted to use SQAP for the tumor. Next, please. This is a 14-year-old Mongrel Cat with squamous cell carcinoma. Left photo was taken before radiotherapy. A mass is seen in the right upper jaw. Then the right photograph was taken 1 month after SQAP radiotherapy, and the mass is clearly shrinking. On the other hand, the maxilla is exposed where the mass disappeared. Next, please. The next case is a 12-year-old Mongrel cat with squamous cell carcinoma in the right upper jaw. Left photograph is 1 month after the treatment. The cancer completely disappeared. In exchange, you can see the oronasal fistula has formed. Next, please. This slide shows CT image taken from the same cat. Before radiotherapy, the maxilla is destroyed and the tumor invades the right nasal cavity. The mass replaced the nasal wall. After the treatment, the cancer shrunk significantly, but resulting in the formation of oronasal fistula. We consider that SQAP had a radiosensitizing effect because the tumor usually doesn't shrink sufficiently with our palliative attempts. But oronasal fistula badly impair the quality of life for the cats, which was a apparent drawback of the therapy. Next, please. So far, we treated 7 cats with oral squamous cell carcinoma with SQAP radiotherapy. In the graph without using SQAP, left side, in only 1 cat, the tumor reduced in size. In 3 cats, tumor did not show change. And in 1 cat, the tumor enlarged. Like the radiotherapy using our palliative protocol didn't work well for the tumor. In addition, there were 2 cases in which treatment could not be continued due to the poor physical condition. In the right graph, is using SQAP. In 1 cat, the tumor completely disappeared. In 5 cats, the tumor reduced in size. And in 1 cat, the treatment could not be continued due to poor physical condition. To summarize, only 14% of cases without SQAP appear to be effective, while 86% of cases with SQAP show the cancer shrinkage. Radiosensitizing effect of SQAP is apparent in the cat with squamous cell carcinoma if you ignore the big drawback from the formation of the oronasal fistulas. Next, please. Generally, sarcoma aren't very sensitive to radiotherapy. The next case is well differentiated fibrosarcoma in the dog. Next, please. The case is male 8-year-old standard poodle. You can see the swelling around the left eye. Next, please. The slide shows CT image before radiotherapy. The tumor has grown extensively along the left lateral maxilla. Tumor destroyed the maxilla and the zygomatic arch. The tumor also invades into the left orbit and exclude the left eyeball in the dorsolateral direction. As you can see, the tumor was not surgical resectable, so we decided to use SQAP for radiotherapy. Next, please. The CT image in this column, the left side column, were taken before radiotherapy. And these in this column were taken 40 days after the end of therapy in the middle. At this time, the left eyeball was returning to its normal position at 40 days after therapy, but sufficient mass reduction was not observed. 108 days after the therapy, the tumor eventually shrunk clearly. The position of the left eyeball rather returned. Before the radiotherapy, I explained to the owner that radiotherapy would not be effective enough because of the nature of the sarcoma, but the owner was very pleased to see the unexpected improvement from the SQAP radiotherapy. It is not possible to say definitive things with only one case with this type of sarcoma, but it is still a case where the radiation sensitizing effect of the SQAP was realized. Next, please. The slide shows the changes in the facial appearance over time. Hair loss and the pigmentation were observed over the irradiated site at 40 days after the end of therapy. After that, at 108 days later, the hair coat had returned to normal, and the swelling of the left upper jaw also had greatly improved. When we started using SQAP, I was worried about the acute side effects in normal tissue would worsen, like conjunctivitis or dermatitis. So far, we haven't found any cases where SQAP worsened the acute side effects compared to the therapy without SQAP. At the 229 days, you can see the opening of the left eye fissure got slightly abnormal. Next, please. After 278 days, the middle column, the tumor had grown again. So we decided to perform irradiation with SQAP on the mouse. The tumor shrunk again at 49 days after the irradiation, as shown in the photo, but he died after 461 days after the end of initial radiotherapy. Next, please. So what about the effectiveness of SQAP to canine nasal adenocarcinoma? Next, please. This graph shows the percentage of tumor volume remaining at 1 month after radiotherapy in proportion to the volume before the treatment. The graph on the left is without SQAP. You can see the volume reduction in all cases, but volume reduction is not enough in 4 out of 11 cases. On the other hand, in the right graph, remarkable volume reduction was observed in all cases with SQAP. From the results, it is considered that SQAP has a radiosensitizing effect on nasal adenocarcinoma. Next, please. So far, I haven't experienced any unacceptably serious side effects from SQAP radiotherapy. The obvious side effect is irritation to the vein at the injection site and mild vascular pain during the injection. If it leaks out of the vein during injection, significant edema will occur around it, but it will recover in a few days without any problems. Rapid intravenous infusion of SQAP may cause decrease in heart rate due to atrioventricular block. This can be prevented by premedication with atropine or through IV injection. Very goodly, in the range of blood examinations, SQAP does not cause kidney, liver, bone marrow, or blood coagulation disorders. Next, please. In Nihon University Animal Hospital, we have used SQAP for over 400 cases since August 2017. The reason we have continued to use SQAP is that we feel that SQAP has a sharp improvement of clinical symptoms from and volume reduction of tumors. Next, please. So we researched the effectiveness of SQAP radiotherapy for the dog with nasal epithelial tumors. We retrospectively used 60 cases without SQAP and 46 cases with SQAP. The tumor volume after treatment is shown in proportion to the volume before treatment. The smaller the number, the greater the volume is. Please note that this analysis is still in progress. You should focus on the outline of the vertical bars rather than the absolute value of each bar. So next, please. So please note that this analysis is still in progress. So you should focus on the outline of the vertical bars rather than the absolute value of each bar. The gray bars show the group without SQAP, and the yellow bars shows the group with SQAP. The percentage of cases for complete remission is clearly higher in the group with SQAP than in the group without SQAP. This tendency is the same for the range of 90% or more and 75% or more. This result may reflect my subjective feeling that tumors shrink and the clinical symptoms improve quickly in some patients using SQAP. Looking further, the relationship between the two groups is reversed in the range of 50% or more. The tendency is the same for the range of 20% or more, 10% or more, and less than 90%. The last bars in the left-hand side mean the tumors grew despite the radiotherapy. The percentage is overwhelmingly higher in the group without SQAP than in the group with SQAP. Next, please. The conclusion of my presentation is that SQAP has a radiation sensitizing effect in clinical cases. SQAP is a safe radiosensitizer. Thank you very much for your attention.
Thank you very much, Dr. Nakayama.